I'm Dr. Suzette Glassner, clinical psychologist and associate professor in the Department of Psychiatry and Biobehavioral Sciences at UCLA, and you are watching the Dr. Suzette Glassner podcast. On my show, I bring the latest advances in addiction science and unpack them in such a way that they are understandable to everyday people who struggle with addiction themselves or know somebody with addiction or just have curiosity about this topic. And oftentimes it's helpful to think about some of the news headlines that we're hearing that involve addiction and addictive behavior, just as a springboard for understanding our current thinking in the field of addiction science and how it might be applicable to your everyday life. So I'm going to start by talking about a topic that recently hit news headlines. And this topic is that airlines are now carrying the life-saving overdose antidote naloxone, which is more commonly known as Narcan, on board their flights. And the question I want you to ask yourself and hopefully have an answer to, or at least enough information to inform an answer to, is should you carry naloxone or Narcan? And that's whether or not you know or love someone with an addiction. So let's talk a little bit more about this news headline. Southwest Airlines is now carrying naloxone on all of its flights. And the first question is, why are they doing that? Is it because drug overdoses in flight are very common? And the answer to that is we actually don't know. There haven't been specific studies looking at how frequently drug overdoses occur on aircrafts, but it did happen close to 9 months ago on a Southwest flight. And this is what prompted their thinking about this and the potential importance of carrying this medication. So what actually happened? There was a young, in his 20s, male passenger on a Southwest Airlines flight. They were about 30,000 feet in the air, and he became unresponsive. A couple of people who were traveling with him revealed to the airline staff and people around them that this young man was struggling with opioid addiction and had recently been experiencing some relapses and having a really hard time staying off of opioids. So the first question that was floated by someone on the plane was, does anyone have Narcan? And the answer is nobody did. Nobody had Narcan on the flight. And we're going to talk a little bit more about what Narcan is and what it does and why was that the first thing that people were asking about. But Narcan, given that this young man had overdosed on opioids, Narcan could have saved his life. But because nobody had it, this man was very lucky because there were a couple of people on the flight who were healthcare professionals. So they performed life-saving measures to attempt to resuscitate him while the plane was making an emergency landing. And thankfully for this passenger, they did save his life and managed to keep him alive long enough to get to emergency personnel. And what was the first thing that the emergency personnel did? They administered Narcan. They actually administered 2 doses of Narcan, and the individual started breathing again, and they saved his life. So what is Narcan and how does it save people? Narcan has actually been around for longer than you might think. Narcan was discovered in the early 1960s, and it was initially developed as a medication to overcome some of the unpleasant side effects of opioid painkiller medications like constipation. Then it was discovered that it actually could reverse an opioid overdose, and it was then about 10 years later FDA approved for that purpose. So how does Narcan do this? It's really pretty interesting what it does. And it requires a little bit of an understanding of the sort of neuroscience basis of our body's response to taking an opioid medication. So I'm going to go through that briefly. So what happens when a person takes an opioid, and opioids can include heroin or prescription painkillers. Many of you have probably heard about fentanyl. That is an opioid. So those are just a couple of examples. And when a person takes one of these drugs, what it does when it reaches the brain cell is that the opioid will attach itself to what are essentially receivers of a chemical in the brain, and we call those receptors. So the opioids will attach themselves to these receptors in the brain, and when they do that, that's when a person experiences both the psychological and the physiological effects that the opioid brings. So in terms of the pleasurable effects or the positive effects that people are usually seeking when they're taking an opioid, they can experience a rush of pleasure, also known as euphoria. So it's a really, really good feeling. They can also experience pain relief, which is one of the top reasons that people begin taking opioids, even if they become addicted to them later. But then there are also some other physiological impacts of opioids. So one of those is that it slows down the brain's respiratory center, and that's the center that enables us to breathe. If you take too much of an opioid or so much of it that your body is not able to tolerate it and you're experiencing toxic effects of an opioid, that depression of the respiratory center can actually be so extreme that it shuts down your breathing completely. And that is what happens when somebody overdoses on opioids. Essentially, the opioids attach to the opioid receptors in the brain, and then it shuts down the individual's breathing. So Narcan comes along, and when you administer Narcan to somebody, what does that do? It boots or kicks those opioids off of those receptors, and it attaches themselves instead. So by kicking the opioid off of the receptors, it then reverses whatever those opioids were doing. If they were making you feel good or if they were depressing your respiratory center, those impacts are reversed, and that's what enables somebody to breathe. And that's essentially what saves their life. So why are people worried about or hesitant to carry or administer Narcan? One of the reasons is that there's a worry about what are the adverse effects of Narcan, if any. Thankfully, the adverse effects are very minimal. But if you think about what you're doing by kicking opioids off of a brain receptor, you're essentially imposing a condition where a person is going to withdraw abruptly from opioids. And opioid withdrawal is not fun. It is very, very unpleasant. And the severity of the symptoms that people tend to experience when they're in opioid withdrawal, it basically feels like the worst flu you've ever had or could ever imagine. You've got the chills, you're nauseous, you're vomiting, your body hurts all over. It's a very, very unpleasant experience, but fortunately, generally not life-threatening. So while very unpleasant, if you are weighing the risk of an opioid overdose, which can be fatal, to the risk of administering Narcan, which can lead a person to feel not very good and some symptoms of opioid withdrawal, then obviously the risks are greater in the overdose scenario. Sometimes people wonder, well, what if I'm wrong? Somebody's unresponsive and maybe they overdosed on some other drug and it wasn't opioids. Will naloxone or Narcan actually harm them if I give it to them and they didn't overdose on opioids? And the answer is no. It won't really do anything harmful if you happen to be wrong. So certainly it's better to err on the side of caution and administer it because, again, the adverse effect or side effect profile of naloxone is very, very low. So there's not really any safety concern about using it with somebody who may not have overdosed on opioids. And then the other question is, how do you do it? Is it easy to administer? That sounds like a medical kind of thing, and I don't blame you if you're wondering that. But now there are various forms of Narcan, and after this episode, I will provide links to a little bit more information about how you administer it and what form it takes and where you can get access to Narcan. But probably the most convenient and easy and user-friendly form that we have today that is highly effective in reversing overdose is a nasal spray form. And if you just think about a nasal spray you would use for allergies, it's pretty similar. It comes with a little plunger and you spray it into the nostrils and then you call emergency personnel. You always call emergency personnel because one dose of naloxone is not necessarily sufficient. Nowadays, we're seeing a lot of fentanyl mixed in with opioids. Sometimes people end up taking an opioid pill that is laced with fentanyl and they don't know it. And it can be harder to reverse an overdose to fentanyl because it's such a powerful and potent opioid. Not impossible, but you definitely need emergency personnel to fully assess and evaluate the state of the individual and see if they need further medical attention, which they likely will. So that's a bit about how Narcan works, why it's being carried on planes. So the next question you might ask yourself is, why should someone who's not a medical professional carry Narcan or naloxone? And there are a couple of reasons. The first is the magnitude of the opioid overdose crisis is really pretty astounding. So in 2022, over 106,000 people died of a drug overdose, and the majority of those numbers are accounted for by opioids. And in particular, the synthetic opioid that you've probably heard of that is known as fentanyl. Fentanyl is such a powerful and potent opioid that it takes really a very small quantity of fentanyl for a lethal overdose to occur. It actually looks almost like a speck of dust, the quantity of fentanyl that can lead to an overdose. So because we're seeing a lot of opioids that are being sold illicitly containing fentanyl or being laced with fentanyl, unbeknownst to the person who is trying them or buying them and taking them continuously, the risk is higher than ever that an individual who's really not even trying to use a super potent opioid like fentanyl will end up ingesting it and accidentally overdosing. So not only is the magnitude of the opioid overdose crisis becoming so large, but also something that we've learned from research is that 80% of drug overdoses occur outside of the context of a medical setting. So 8 out of 10 times when somebody overdoses, they're really dependent on largely non-medical professionals who are around them to save their life. And that's why, whether or not you know someone or love someone with an opioid addiction specifically, carrying Narcan can really have a very profound and literally life or death impact on another human being. The other thing I want to cover is, are there people for whom it would be especially beneficial or recommended to carry Narcan or naloxone with them? And I would say there are two groups. So one is if you know or love someone with an addiction. It does not need to be an opioid addiction. It could be any addiction because, as I mentioned, people are unintentionally taking drugs that are laced with potent opioids. And that's an unfortunately increasingly common story around an overdose fatality or an overdose scenario. So even if you love someone or know someone who's addicted to stimulants, we are seeing a huge spike in combined stimulant and opioid ingestion leading to an overdose, and it's really being driven by the presence of these potent opioids. But again, a person may think that they're taking a stimulant, or maybe they're intentionally taking a stimulant combined with an opioid. That is also a thing that people do, but they're not expecting the opioid to hit them so hard as to cause an overdose scenario. So if you know or love someone with an addiction, you are a great candidate person to carry naloxone or Narcan and for that to have an impact. And then the second subgroup is parents of teens. And it doesn't mean that you have a teenager who's a drug addict. This is not intended for a parent of a teenager who has necessarily ever been using drugs to your knowledge. But teens experiment and teens have friends who experiment. So if they're having friends over, you are better positioned to deal with an unexpected emergency if you have Narcan at home. So we know from a recent study, and I'm going to cover this in further detail in one of my upcoming podcasts, that in 2022, 22 adolescents between the ages of 14 and 18 died every week from a drug overdose. Again, these are not kids with addiction necessarily. They could be. They certainly could be. But increasingly, illicit substances are becoming available and are acquired through social media. So a teen may be chatting with someone who says, I have these pills, they'll make you feel great. They may think they're getting a benzodiazepine like Xanax or Valium. They may think they're getting an opioid painkiller and it's going to make them feel really good, and they're just experimenting. And they could end up taking that one pill that they got from somebody on social media or from somewhere else that can lead to a fatality. It's really, really sad what's happening to our youth right now and just how dangerous it is for them to experiment even one time with taking a pill. But because of that unfortunate reality, parents of teens are a great group of people to have Narcan on hand just in case anything were to happen. So I hope that you've learned something that is useful to you and that I have brought a little bit of our latest in addiction science to help you to be more informed about Narcan and about these news headlines about Southwest Airlines joining several other airlines now who have decided to carry Narcan on board. Alaska Airlines is one of them, United as well, and there are a few others. And this is all a movement in a great direction towards ensuring the public safety of our population that is increasingly impacted by this opioid overdose crisis that we are trying so hard to overcome. So if you'd like more information about Narcan, if you'd like to read a short version of what I've been talking about today, visit my website at drglassner.com and subscribe to my weekly newsletter, which will equip you with one fact, one scientifically based fact every week rooted in addiction science, and one action you can take as a result of what you know. We'll see you next time.